One of the questions that I get asked is, if palliative care truly is increasing in the United States, why do we see, at least in some studies, an increasing prevalence in symptoms? And I think there are really three answers to that. The first is that our population is changing. People are living longer, and they're living with serious illness for many, many years, and serious illness comes with symptoms. 10 or 15 years ago, you would develop a serious illness, and your life expectancy might be relatively short. Today, for example, we've turned AIDS from a universally fatal illness into a chronic disease. Many cancers are both cured or transformed into chronic illness, and yet in both of those conditions, the symptom burden doesn't go away. So what we're seeing in the United States is people living much longer. More people are living longer as the baby boomers age, and they're living with multiple chronic illnesses, functional limitations, and cognitive limitations. And so the overall burden of disease in this country is increasing. That's the first thing. The second is that we still do not have a workforce that is trained in core palliative care knowledge and skills. Palliative care teams and palliative care specialists see only a fraction of people living with serious illness in this country. And if we take my education as an example, I spent 4 years at a very well-known, large Midwestern medical school. I spent 3 years at an Ivy League school in New York City, completing my internal medicine residency. I spent another 3 years doing a geriatrics fellowship at my current institution. In that 10 years of medical training, I had a 30-minute lecture in pain, and it happened in my first year pharmacology course, and it dealt with how drugs like morphine are broken down in the liver and excreted in the kidney. And when I'm sitting beside a person who has 10 out of 10 pain, recalling that information is not terribly useful in treating their distress. I had even less education on how to treat breathlessness, fatigue, anxiety, depression in the setting of serious illness. And that was the norm for my generation. I wasn't the exception. So it's perhaps not surprising that as we have a population that's aging, living with chronic illness, with symptom burden, that we're not doing a good job at treating the majority of people who are suffering.